This is an ultrasound study of a 70 years old female with a cirrhotic liver, and what we are seeing is that the outer surface of the liver is irregular, is surrounded by fluid, and this is the outer surface of the liver and it's surrounded by fluid. Its echogenicity is diffusely raised. Now this is fluid with echoes, because the fluid is not as black as this area. Fluid without echoes will be like this, and fluid with echoes will be show you blurred. Okay, the fluid will appear blurred, and when the fluid is clear, it will appear as black as this area is. Now the outer surface, the parenchymal echogenicity, you can see raised, coarse, and a few minor portal vein radicals seen though. This is the portal vein. Now this is the portal vein, this one. Okay, at the porta hepatis and then intrahepatic region, it measures 8.6 millimeters and is patent. Now you will see a bright linear structure running anterior to the portal vein, shining, and it will give shining as well. Here we are. Now what is this area? This area, this linear structure. This linear structure. Now this is the CBD. This is the linear structure. What can it be? Okay, this is a stent placed within the dilated CBD. Now this is the stent, and this is the outer surface of the or anterior wall of the common bile duct. This is the posterior wall of the common bile duct. Measures 9.1. Patient has had cholecystectomy, so up to 9 will be considered as normal. This is the liver. You will see there is intrahepatic bile duct ectasia. Here you can see the bile ducts are dilated in the pseudojaw and are seen more in the left side than on the right side, and the liver is seen below costal margin, is minimally enlarged. Within the liver you will see cystic areas surrounded by dense coarse echogenic area rim. Now this is a cystic area seen in the liver just near the visceral surface, and it has an irregular echogenic rim around it, no posterior wall shadowing seen, and there is a septa within it, and it measures 23 by 21 millimeter. This is a focal lesion. This is not a simple cyst. Remember why it is not a simple cyst? Because we do not see any posterior wall acoustic enhancement. Posterior wall is as echogenicity or brightness is equal to that liver surrounding this cystic area in a cirrhotic liver. Similarly, there are a few more satellite lesions like the one I have shown you. Here it is. This is the other one. This is the other one. But it has echoes within it. Let me magnify and show you. Yeah, here, this one. Now this is again a cystic area surrounded by an equigenic rim, and is also at the visceral surface of the anterior segment of the right lobe. This is the falciform ligament. This is the fluid surrounding the outer surface of the liver. So at least two can be seen. Always differentiate the cystic simple cyst versus a complicated cyst by giving a sweep to the probe and seeing that whether it changes its shape or it doesn't change its shape. Now this cyst is not changing its shape as I am giving a sweep to the probe. Secondly, we don't see any posterior wall acoustic enhancement or strong back wall. Thirdly, the cyst is not clear internally. It has septa, tiny septa within it, and is surrounded by a thick wall. And you can see the critical angle shadow. This is a critical angle shadow from it. So this is a complicated cyst or a focal lesion in a cirrhotic liver. And when the liver is cirrhotic, you see such cystic area. Now it can be some necrotic focal mass lesion, and that it is. So there is a necrotic focal mass lesion seen. Another thing is that we have to report the patency of the stent. You see, now this is the stent, and you can see I can see the clearness of its internal lumen. So the duct is the stent is patent so far that I have seen. Here is the pancreas. Let's study the pancreas. This is the pancreatic body, this area, and this is the pancreatic head. This is the splenic vein, this is the spiromesenteric artery, this is spiromesenteric vein, this is the spiromesenteric artery, this is the aorta. So in transverse section, the duct this is the duct, pancreatic duct. In the body region, it measures 3.0, is mildly dilated. However, the liver does not show any, pancreas does not show any change in its dimensions, significant change in its dimension. No focal mass lesion is seen relating to the pancreas, and here we see the portal vein, and now you will see the stent in the CBD entering the liver. This is a broken view. Let me have a linear view. Now you see this is the stent, this area, and you can see the clear lumen. So the stent is patent so far. That has been placed to remove the obstruction. She is a known case of obstructive jaundice. Cause, I don't know, not mentioned. And this is a typical artifact which you will see with the steel clips or stents in transverse section. So anyway, we see a normal pancreas. लत्तां सीधियां कर रहे हैं. We see a patent stent. Again, now see, this is a good picture. see the clear lumen. Internally it's clear. So the stent is clear, the pancreas is normal, but there is ascites, and the ascites is moderate in amount. This is the uterus in transverse section, and this is the uterus in longitudinal section, and this mild dilation of the endometrial canal. You will see that the fluid contains multiple dancing septa within it. You see, this is the septa. These thread-like structures flapping around are the fluid septa in fluid, and the fluid this is all fluid, but it's not that black as this area, so it's full of echoes. This is our case of the day. Thank you very much.